welcome to Digital Health News and yet another episode of DHN CXO Podcast. Well, healthcare has always been about people, but increasingly it's also becoming more about technologies and the platforms that are powering healthcare. And as Indian hospitals race towards digitizing, also inculcating technology, imbibing technology, and future-proofing their technology stack, the role of the Chief Technical Officer is more critical than ever, if not more complex. And that's what we are going to discuss today, how to build a future-proof, technology-led hospital from ground up. And that's what we are going to discuss today with Chief Technical Officer and Head of Project at Jupiter Hospital, Mr. Neelesh Shinde. Thank you so much, sir, for joining us on Digital Health News today. As we were discussing before this, you made a point and I have to tell all of our viewers, I think you have become an accidental CTO. You were never meant to be, in this field of technology as such. You were graduating, sort of looking at becoming MBBS doctor. How did you, in fact, stumbled into the technology field or technical field, so to say?
So Aarti, this is really an interesting story, and somewhere we say that destiny is written. Okay, so during my school days, I always thought to become a MBBS doctor, and that was my aim. Very clear aim was there from day one that I have to become a doctor. But unfortunately, during my 12th exam, I couldn't give my practical exam because of chicken pox, and then finally I landed up in a scenario that there was no other option but just go for the engineering. And really saying, my mom really insisted me at least I should do engineering, because I took admission for BSc and was happy with that. Okay, now I can't become doctor, better I will do something in microbiology or something. And what happened is that when I took the admission in 92, during that time, there were three options were available with me. So it was civil, electrical and biomedical. And I was not aware anything about biomedical, but just the medical terminology was there. So I thought, okay, we will do something, at least not MBBS doctor, but at least I will become something in hospital. And that's the reason I joined. I was really not knowing anything, and it is like accidentally I gone into biomedical engineering. And first 4 years after 96, when I passed out, that time I did my training in implant training in Siemens, and that was on the X-ray. So I started my career, I can say, in healthcare in radiology setup. And then slowly, after passing out, I joined a company called as LSINT in 1997, and that was basically into CT scan and MRI machine. And luckily, I got a chance because it was a good breakthrough to start our career in installation of 0.5T superconducting MRI. That was the first MRI in private setup, and that has happened at Jupiter Scan Center. And owner of that is like Dr. Ajay Thakkar, who is the chairman and MD of Jupiter Hospital Group. So I'm talking 1997, the first person I met in healthcare industry is Dr. Ajay Thakkar sir. And he taught me that time, because that was smallest site. So he taught me in that also we have to do it. And client has told that we were from company side that we have to do it. And we could able to do that.
And quite an interesting journey. I mean, a lot of people we know in healthcare, they come with intention to be in healthcare. You always had that intention to be an MBBS doctor, maybe serve people clinically, but here you are serving people, enabling technology layer that, sort of helps and supports the clinical function of the hospital. That shift has definitely been a destiny of sorts for you. And one of the incidents that you also mentioned during our conversation, Mr. Shinde, is one incident that has stayed with you, the incident from Nanded, wherein there was a riot and you had to install a CT scan machine. Tell us about that. What happened at that point of time?
Yeah, like with everyone, what happens that everyone is having a bookish knowledge. Okay, just like a Bible for biomedical engineering, there is a book called as R.S. Khanpur. So we all learn, everyone learn on that, and they were talking in that book something around 1969 how the CT scan has started. All the data were there, and that was what we all learned. But we were not sure what happens on site, because that experience was never been there. And I still remember when I was a part of Viproji medical system, one call in 2000 has come in Nanded city, and there was some unrest in that area. Curfew had been imposed on that time. I still remember when by Devgiri Express, I reached to Nanded, and the consultant told me the vehicle will come to pick you up. I was so happy that as a doctor, as an engineer, when someone is coming that time in 2000, that vehicle is coming and to pick me up. I was so excited. But half an hour did not come because that time mobile was not there, only pager was there. Again, I waited for a long time, and suddenly one vehicle came. I went to that place in police van, and then I realized there is something wrong in this, and there is a curfew has been imposed. And I reached to that location where this CT scan was down, and that was during Ganpati festival. And when I went there, then I realized what is the reality. I saw so many patients were lying there. They have to do some scan, and if this machine is not work that time, it would have been really difficult for me. I was really under pressure to make sure that machine should get up. But as I said, there's a whatever is theoretical and practical, there is a huge differences there. And I can say, again I can say it is destiny or luck for me that I could solve that problem in 2.5 hours. But after that, back to back 20, more than 20 CT scans has been done. I was under really tremendous pressure for that 7 to 8 hours. I was watching every time what should not go wrong. And after 20 scans, somewhere around 7:30 in evening, while I was leaving that place after completion of all the scans, the one person or maybe patient relative came to me. He was not knowing whether I am doctor or engineer. He just told me, sir, because of you today we could able to save lives, because there was not possibility to go outside because we cannot do diagnose also. So better to whatever you are done is a really excellent job. So you are like God for us. And then that moment I realized that, oh, so I may not be the clinician, but whatever work I have done, it has helped the clinician to get the data, because CT scan was up, they could able to do this diagnostic, they could able to do scanning, and otherwise it was not possible for them, for those patients to go 4 hours from that place because curfew was there. And after that they could able to do their treatment, and that point was a like turning point for me. Then I decided now is enough. Now even if it is biomedical engineer, I have to make my career in this field only. And from 2000 onwards, seriously took this biomedical engineer is my first goal. And in around 2004, I joined Dr. Ajay Thakkar, who is the chairman and MD of Jupiter Hospital Group, and as the first member of this Jupiter Hospital. From that day onward, patient first is my ideology. And as an engineer, I can also think from patient first point of view whenever the crisis situation comes.
Absolutely.
That is my real journey.
That's actually a fantastic anecdote that you shared with us, because 2002 I believe and CT scan machine at that point of time would still be rare in India. Even today CT scan machines or the MRI machines are prevalent in Indian hospitals, but we are talking about 2002 where it was very rare to have some sort of that kind of technology within hospital setups, and that too in a city like Nanded, in between an unrest. So any doubt or any regret that you might have had that, okay, I should have, gone for MBBS, or I should have done something in the clinical area, that regret, I believe, that day sort of wiped out from your heart, from your mind.
Yes, absolutely agree with you. That was the day I can say that made me sure that now I have to stay. Right. Even if I'm not clinician, I will do something for the patient. That confidence I got on that day.
Well, let's come to your association with Dr. Ajay Thakkar. You also mentioned you joined Dr. Ajay Thakkar in 2004 as founding member of Jupiter Hospital. But even before that, you were sort of associated with him in a different capacity, maybe. How has over the last 2 decades, I believe for more than 2 decades, you are now with Jupiter Hospital as a founding member. How has that association been over the past, more than 2 decades?
So, as I mentioned, the first person I met in '96 is Dr. Ajay Thakkar, and he taught me about timeline management, what is the patient first ideology. So it was always there in my mind. Okay, whether I was part of some other organization also, that was always there in my mind that we have to look. As an engineer, we have to look from that angle that patients should get that service, because that is very important. And accordingly, 2004, when I joined here, okay, I can say very clearly I was not knowing anything about project. Okay, I joined here as a chief biomedical engineer in Jupiter Hospital and project coordinator, because when I met Dr. Thakkar, I told him also very clearly, sir, I don't know anything about project because my role was something different. Okay, and now I'm going to play some different role. So he said, okay, just aa jana, we'll hospital banayenge. And really, because I was knowing his vision, because I was knowing him just 10 years prior to that also. So I was clear that his vision was very clear. He was looking for something in Thane city, where in Thane city during that time, there was no tertiary care hospital was available. This I am talking about 2004 when we are planning this hospital. And for everything from Thane, we used to go to the Mumbai. For any crisis situation, there was no other option. So he was thinking very clearly, and his thought process was clear that we have to make some 250 or 300 bed in Thane city, where people from Thane will able to get the whatever the necessary critical services at one location. They do not have to move from pillar to post. And his vision was very clear, and it's like patient first. It is like to win their war against disease by creating better infrastructure, technology, and support. So that was a clear idea, and we have gone ahead with that.
And as you rightly mentioned, patient first is not just an ideology, it has to be a practice, it has to be a habit for everyone who is working in a hospital, because that's where you are delivering the outcome for your patient. You're delivering care to them, you're delivering not just a treatment but also a sort of a touch of care that stays with them, not just for the duration of treatment but that stays for them for the lifetime. And you must have seen so many examples of people saying that you saved my life, as you rightly mentioned, that happened in 2002. I'm sure in your association of more than 2 decades, you have experienced several such moments with Jupiter Hospital as well. But I want to talk about the part where you have delivered excellence for the organization. I mean, you have achieved and have several records under your belt as Chief Technical Officer of Jupiter Hospital and Head of Project. Some of them is the fastest installation of the AI-powered cath lab, as well as the MRI installation that you have done in a record time. Walk us through that journey. What went to your mind, and at what point of time, speed and quality become a practice and not just, a side sort of, you can say, outcome of the entire process?
Okay, so I can put it in this way. When I was part of G Medical System, I used to do installation of CT scan and MRI machine. Okay, so when I used to do CT scan, almost 95 CT scan I did myself that time, and then around 5 to 6 MRIs. So my experience was that whenever I used to go to the customer place, for getting pre-installation requirement, I used to visit 3 or 4 times. Okay, when we do these 3 or 4 times, it is burden for company also to send their engineer, and at same time for the customer also, their site is not getting ready. In that case, how they are going to install the machine, and installation will take a lot of time, and because that what happens, they could not able to serve to the patient. Okay, so even if the machine is available on site, because site is not ready, they used to defer that installation. And okay, that time also cost was really good for any equipment. So it is the interest that they have to bear for that. I personally believe is nothing is impossible for biomedical engineer. Only that the right positive mindset has to be there. In India, the positive mindset I saw in my boss, Dr. Ajay Thakkar, same thing it inculcated in me also. So my team also looking in that way only. That team leader is there on field at any time, because that makes the life very easy for subordinates, our colleagues also, because without team you cannot do anything. So positive mindset, which is first thing which is there. Then meticulous, I can say micro level planning, which is very, very important. Like when we say installation of CT scan, MRI, people are talking about, or in industry, MRI, everyone is talking about 1 month, 20 days, 25 days. And we talk in Jupiter in hours, whether it's 72 hours or maybe 240 hours for MRI, or cath lab like we see 72 hours. So that is the difference. Okay, when I'm saying 72 hours or 240 hours, for 72 times in this case of cath lab, this was AI powered cath lab, and this was the first installation of this in India. So for company also it was a new experience, for engineers it was new experience. But we were sure that if you do the proper planning, because we know one thing very clearly, what are things are required for engineer who is going to come to our place. So normally what are things, the environmental condition like temperature, humidity, the leveling of machine is very, very important, and it should be available with them on day one. You have to work as a team, like it was like GE has done that. with Siemens we are done with MRI. So when we did that, the first thing is that we said that it is one team, like Jupiter and G or Jupiter and Siemens is the one team, and we have to achieve this goal. Okay.
It's not a hospital
It's-
vendor relationship.
no, it was like a partnership. We have to achieve it. First, always everyone used to say, "Sir, ये होगा नहीं." And I always say that negative or no is not there in my dictionary. So it will happen. So that is a positive mindset, which is very clear. And nowadays I will tell you that wherever we are doing installation across any of our unit, for all these companies, they are having a different installation schedule for us as a Jupiter. Because third thing is that you are a positive mindset, you are meticulous planning, but finally it is execution. And execution is very important. Things can go wrong if you do not properly do execution. So like as I mentioned, that 72 hours, the way we mentioned, our own team, our biomedical team, our maintenance team, our project in-house team and G team is like cohesively it work like only one team. And with only one goal very clearly that we have to achieve it. And now with so many experience earlier also, like we did twice, we have done Southeast Asia record for MRI for 10 days. Cath lab we did it twice. So everyone is so geared up that with these three things, if they are in place, we can do any magic. And I'm telling you, my personal opinion, biomedical engineer can do any wonder. Nothing is impossible for them.
And that brings me, you certainly touched a little bit upon your definition of project that you were mentioning about in our previous conversation. I would definitely like our viewers to also hear that definition. And it's quite an interesting factor because it is not only derived from your experience but also from your practical insights of working into this field for these many years, sir. So I would definitely like to touch upon that. But before that, I would also want to ask about your leadership philosophy. When you say that Jupiter Hospital has a different timelines, which is in hours for technology installations and not in days, that also means there is a high pressure to lead your team the right way and deliver on that promise. And the margin of error is almost zero in this kind of situation. You have led greenfield commission projects. You have also led the 72-hour round the clock, technology implementation and commissioning of hospitals. So when you're leading in such an environment where, sort of the margin of error is almost zero, how do you stay motivated? And what is your leadership philosophy to lead your team?
So here I can say first thing is that there is no pressure. Absolutely no pressure because it is like positive mindset. ये करना है. Okay, so absolutely no pressure on us, and we always deliver. Make sure that next time we will at least reduce by 1 or 2 hours in that 72 hours next project.
You take it as a personal challenge.
Yeah, it's like we can do it in 70. And I know that once someone thinks about that leader, then everyone just follow them. Someone has to think, and he has to think very positively. Team has to be there united. The team leader has to be active. He has to be there always on the field. It is like something like battle. Okay. So one advantage, what we say about 72 hours when we did that, or whenever we are doing the fastest installation, which is unique in this healthcare industry, is that in our case, the maintenance, biomedical, and project is having a single leader. Okay. Like what happens that when we are doing installation, if these three different departments are there, different heads are there, things are not getting sync. ये मेरा काम नहीं है. This is not my work, job profile. Here in our case, because they all three are reporting to me, so it makes life easy for everyone. And as a on top, I know that this work will be done by this guy, and that meticulous planning which is there, it is like very in sync manner, and that is a real advantage for us. And I believe, and I can say that is a unique proposition in healthcare industry to have this.
Right.
And that is the only mantra of doing this. In-house, we are doing so fast installations. Everyone get really, really excited when a project comes. Okay. So similarly happens to us also. I will tell you because I mentioned that when I passed out in 92, there are three options were there, like civil, electrical and biomedical. I opted only biomedical and left civil and electrical. And when I joined here in 2004 also, I joined as a chief biomedical engineer and project coordinator. Okay. But my experience of last 22 years on field, in all these fields like civil, electrical, mechanical, plumbing, everything, and interior. So I made my own definition of project. Okay, that is not from chat gpt or something, it's my own definition. So when I'm saying project as a word, okay, so when I'm saying project, then P stands for me is like positive thinking. Okay, whenever small project, big project, whatever projects are there, any assignment, someone has to think positive कि ये होगा. And we always believe that if I have to work in 8 hours, target for 7 hours. There is no point saying 10 hours and then sending mails to everyone that I have done in 9 hours. There is no fun in that. It's R. It stands for me is like resource allocation. Whatever people are there with you, you have to work with them. You cannot say every time that I don't have manpower, how can I do it? You have to plan in that way, that resource allocation throughout that project we have to plan, because there are some festivals come. I know, Holi, some festivals are there. Now you have to emphasize that, you understand that in advance, because in projects, in hospital, most times sometimes you get only during those festival days only you will get that shutdown time. Okay, so you have to be ready with that. So resource allocation is very important. The third letter is O. O stands for me is a one team concept. So whenever you are working on any project, whether it's own in-house team or other agency or other partners, you have to work as a one team only. You have to make sure that we are working as a one team. The letter is J. So for me, like a judgmental approach. These are the problems can come, but we need to also find out what is the mitigation for that. We cannot just stop in between. When I'm saying 72 hours, it is not so easy. Even if you plan something, something can go wrong. Maybe 2 hours can become 3 hours. And then you need to understand how to make sure that the 1 hour which has been increased, how to just take care of that. So that judgmental approach has to be there. Then E, the next letter E is effective communication. A project may effective communication very important. Okay, whether you are communicating with plumber or electrician or their whosoever supervisor, the communication has to be clear and complete. Okay, it should not be just on WhatsApp something has given to them where they are not read, or we don't know also sometimes. So that communication gap can happen in this 72 hours. We cannot have that challenge that someone has missed that. So you have to be active, do the proper effective communication. And the next letter is C. So C stands for me like chase for the goal. It is someone has to, just like a mad guy has to chase for the goal. Yes, we have to do it, and then things will fall in place. I'm sure about that. And the last thing is timeline management. This is very important, because everything is there on paper, but why it doesn't happen on actuality? Because when we do design, planning and execution, the execution part is something different. On site problem can come, and for that to avoid, we have to have a proper timeline management. If we do all these things, I'm sure success is there with us.
Absolutely, sir. I think this is like a sort of a crash course in MBA for me that you just gave through your definition of project. And I think this should definitely be there in all the biomedical engineering syllabus also. That's a practical insight that you just gave us, of course, free of cost. But behind all of this, one thing is almost important, which I think when we discuss with other leaders of other hospitals, we understand that buy-in from the leadership or the management is one of the major, I would say, a hindrance or a bottleneck where maximum delays happen. In Jupiter's case, when you say that you are able to achieve this kind of record installations or record commissioning of project, that also means that there is a faster decision making internally that is happening at Jupiter Hospital. How has the buy-in from the leadership, or the early buy-in, I would say, from the leadership has shaped the excellence of your work at Jupiter?
So as I mentioned very clearly that for every team, the team leader plays an important role. Okay, for me also, whenever I do some planning, okay, when I'm doing any project, there are planning is there, then designing, planning, execution, and then operational phase. Okay, so in our case, I'm so lucky that Dr. Ajay Thakkar, who's the chairman and MD of this group, as well as Dr. Ankit Thakkar, is the joint MD and CEO of this group. They are there with us. They are only involved with us in designing of any of the project, big project. They are there with us in planning. Okay. So it makes life easy that we are discussing. Very small team is there, and we could able to take decision fast. But this is everything on boardroom level. But when execution happen, problems can come. Okay, problems can come at any time. And when we are talking about the 72 hours or MRI 10 hours, I will tell you, when we did the MRI in 10 days, the Diwali vacation was there. Okay, I still remember some Diwali second day was there, and we came across in night some issue there that we were stuck in between, and I was looking for some solution because that was something planning difference was there, and we were looking for some solution, and I just called Dr. Thakkar and asked him that, sir, we require your advice. Okay, here we are stuck up. And when I called him, so he was so sure that yes, there is a real some issue is there, and he has to address that. So he just sent me message immediately that in 2 hours I will reach. That too also on Diwali, and he was there. So entire team was there. So understand the condition that when team is working there, I am there with team, and my supreme boss or maybe supreme leader is also on the field. It makes life totally different. Whenever we get stuck up, immediately we get answer. Like
That's absolutely true because hands-on management and getting clear approvals, clear answers and buy-in from the management is always very important to take the step further, and not only just to take the step further but also that instills confidence in the mind of people that I'm able to deliver this project on the time, and if I am stuck up somewhere, if I am facing some kind of hindrance somewhere, my leadership is always there, it has my back. Obviously that is a most important part when you are taking up such big challenges like building hospitals. From that, I would like to touch upon your Dombivli facility, which is fantastic achievement, and congratulations to you for that. You have installed at the Dombivli facility, which is the HVAC facility. Now you have sort of treated it not as a utility but as an integrated component of the hospital building. And for all of your projects, I can say that technology is not an afterthought; it is a element or a component that you think about when you start building the hospital. Tell us about that.
so, I will tell you what has happened in that when we planned 2007 this Jupiter Hospital Thane, we could able to concentrate more on technology, what was available at that time. But if you remember that time, word like sustainability, green hospital was there, was not as such in discussion. And we saw that in our first couple of years of operation, that our electricity bill was 60 lakhs at that time, 40 to 60 lakhs. And we realized that, oh, so we have done everything there, right? But for the energy, we have to do a lot of things because we cannot afford to have this every month cost. So then from 2011, we decided that the whatever project we will do later on has to be energy efficient hospital. Okay, and when I'm saying energy efficient hospital, you need to do it during project days only. It cannot retrofit is possible, but not so easy because during project phase you can do a lot of things. So when we did our operation of 2017, the Pune hospital, that has become the most energy efficient hospital, which has got the award, Nirman Award from Ministry of Power of India. And then that time it was like energy efficient hospital. So next project was our Dombivli project, and during that project we were so sure that we will have an energy efficient hospital. We are going for platinum IGBC. Okay, so in couple of days we will apply for that also. But one more thing is important, which we find out that when we are doing HVAC, we are more concentrating for energy efficiency, but there is something called as infection control. Okay, in hospital that is a very very important topic, infection control. So there are a lot of infection control measures have been taken, but some are like visible and some are not invisible. So what are those invisible? Invisible is something like indoor air quality. Okay, so when I'm saying indoor air quality, what air we are inhaling, whether that is of good quality or not, no one understands. There are a lot of filter systems are there across hospital, across all the AHUs, but how to track those, whether those are working properly or not, whether those are effective or not. Like as per the norms which are there from the most of the auditors, is that after every 6 months for HEPA filter we need to do third party validation. Okay, so it is something like that we have to wait for 6 months to just see that whether is the OT HEPA filter are working proper or not. okay, but it is gap of 6 months. So we realized that, oh, if it is 6 months and we are talking about indoor air quality should be good, how to tackle these both issues. So we made sure in our new hospital, which has already been inaugurated on 15th of February, already started, we implemented a system where we can able to get the real status of the filters online sitting anywhere. So what has happened because of that? Now it has become like proactive. Okay, I don't have to wait for some 6 months to get the result. I'm getting every minute. So we can do really proactive measures, maintenance activity. We can replace the filter. We can provide a indoor good air quality everywhere across the hospital. So this is what I can say, and this is possible by doing some BMS system, which we have implemented in our organization, and which gives us for all filters across hospital the results online.
And when you mention proactive care, it's not just about clinical systems, as we keep on saying during this conversation. When we talk about proactive care, it does not necessarily have to be only in clinical terms. It can also be non-clinical terms, like, energy efficient building, your air quality, preventing infections through controlling the air quality that is circulating within the hospital building, and also the space, the kind of thoughtful spaces that you build for the hospital. Could you touch upon that factor that you mentioned during our conversation? How this Jupiter Hospital facility, the first facility, was built, and how was the architecture and space was designed for that one?
Okay, so I can put it in this way that when I joined here and the first person I met, architect, and then I realized that that architect was not having any experience of building hospital. He was basically from hospitality. He's an expert into hospitality industry, and that's the reason I can say that whatever we are design is whatever you are seeing right now. The passages are 10 feet, corridors are 10 feet. There is a facility that patient relative, okay. Whenever a patient gets admitted to ICU, the patient relative always get bed facility for having a food also. That is also we are having our in-house kitchen. So patient family also, patient relative also, be always relax whenever their patient gets admitted in ICU also. Because in ward, always patients are relatives along with the patient only. But along with that, if you see that, now if someone wants to come to having some issue regarding chest pain, okay, so either he has to meet, he has to do ECG, he has to do maybe stress echo, or he has to consult cardiologist, and if there is some blockage are there, they have to do cardiac surgeon. So this is what is required for that patient. So the way we design this hospital, okay, now it is cardiology department, okay, so cardiology department will have all these equipments along with all the consultants are in that same thing, okay. So billing also will happen at that same reception. They will get their reports also at same location. So like even if it is like 5 lakh square feet of property, still for them, for patient, they don't want to move pillar to post. They have to just, we always do in planning is that, like we are using PT beam, PT slab technology. Now you know that you might have seen a movie called as Surma. Okay, that was basically on the hockey player Sandeep Singh, and when he has gone for neuro rehabilitation, he has done everything in Amsterdam. Okay, so whatever equipment was shown during that movie, if you come to our third floor of Jupiter Hospital Thane, you will see all these equipments, neuro equipments, at one place only. Okay, now how it is possible? Because we planned somewhere around 2004 this hospital, we installed this in 2018. So, and why it is possible? Because the way we design the hospital, you will not see columns in between. So it is like always open spaces are there, and we have designed structurally in such a way that I can able to install anything anywhere. So we can able to do anything, because if you know that with AI coming up, there is a lot of new development and deployment of technologies there. So we should be ready for that. We cannot say everything we can buy, so software we can buy, but if it is hardware compatibility is not there, structural compatibility is not there, you can't do anything. You are stuck up. So that is where we are having advantage over everyone, because the reason is that because people who are designing, we are part of the designing team. And here one more thing is that, as I mentioned, design, planning, execution and operations. So what happens most times you come across that there is some designing team, PMC team, their role get over at the time of inauguration. They are not part of the anywhere later on. In our case, like we are three of us, we are designing also, we are also there in operation phase. So if something goes wrong, we know that with our mistake, this design was not proper. Because I believe that way we do the design of the hospital, the operation team makes life easy for them, whether it's fire life safety, patient movement, indoor air quality, that everything depends on how we are going to design. So with our own experience of last 4 hospital, now we are building another 3 hospital, it life become easy for us.
When we talk about patient first care, it also means enabling your clinical staff with the technology that will allow them to provide the best of care to the patients that are coming in, and that you have fantastically been doing at Jupiter Hospital, and congratulations for that. Moving on to the part of reactive care, most of the times it is considered that Indian healthcare is more reactive. You treat when the diseases happen to you, and that's what the patient approach has also been for a long time. But we are also moving towards an era where artificial intelligence or several technologies like IOMT, wearable devices, are enabling proactive care, and now patients are also, in some pockets I would say of urban areas or even in tier 2 areas, they are becoming more conscious about their health trackers or their health parameters. When we talk about that, and hospitals having to match up to that expectations of patients, where do you think Indian healthcare is today in the process of personalized care or proactive care, and where do the gaps still exist?
Okay, so I can put it that in Indian healthcare, if you overall if you consider, okay, currently when I'm saying digitization, okay, in corporate hospital it is there.
Yes.
Government is also doing good, like ABDM, they are doing their best. But if you go to tier 2, tier 3 cities, still that infrastructure is not there. To maintain all this digitization, you should have a good server, because there is a real challenge of cyber security. So getting good people who wants to work in healthcare industry is a real challenge as a CIO also. Because healthcare is something like you will say that if the patient is positive, you have to work only in night time, you have to work on Saturday, Sunday. This is not the basically the software engineer is looking for. So that is one more challenge which is there in that. But yes, finally we cannot say that we are not going to implement AI. But currently we are in that transition phase. Still we are just making sure that the I can say digital infrastructure is there. But that is there for few hospitals, I can say. When I'm saying percentage wise, it will be very less compared to entire India, because India is having small hospitals also. They are struggling to do that because getting manpower, infrastructure. But finally somewhere down the line, not immediately, but we have to follow this, because that is finally predictive analysis or a predictive risk assessment is going to play important role. AI still in that phase, that now once we get data from our subcontinent and clinical, if it is correlation happens, I'm sure slowly and steadily for everywhere AI is going to come, and we cannot just get rid of that. We cannot say we are not going to do it, and that is not an option. We have to live with that, but we have to make sure that when we are implementing AI, it's just not like a software, but it should really should get utilized, and that should be in such a way that anyone can able to use that software. Then will it things will become easier for everyone, because maintenance of that software also plays important role. And there where I'm saying that still we are, I can say, in transition phase, but it's not like we are there on track. Everyone is there on track, and slowly steadily we will reach, because still I will not say it's mature in India, but definitely we are on that track of AI.
Definitely. And as you rightly pointed out, I mean, the AI infrastructure or software, as we say, is as strong as the underlying foundation of the hardware. If the underlying foundation of hardware is strongest, the infrastructure is strong, then the AI which will sit on top of it will also perform better for patients. Absolutely. Now let's come to our last question of the day. I know I have taken a lot of your time, but you have been absolutely sporty about that. One last question, sir. What is one piece of advice you would give to young technology leaders who are entering biomedical engineering or healthcare today? Someone who wants to do meaningful work and not just build a career in biomedical engineering.
Okay, so I will put it there with 30 years of experience into biomedical engineering. I mentioned very clearly that for biomedical engineer, nothing is impossible. But when I'm saying there's nothing is impossible, it doesn't come like so easily. Okay. So every day, like even if I'm having so many years of experience, I cannot say I'm an expert in every field. It cannot happen in that way. The technology, the way it evolves every day, it's not so easy to say that you know everything. Okay. So as a technology leader, you have to be grounded. You have to learn from everyone what are the new things are coming and try to implement that the good things out of that. Similarly, as a biomedical engineer or any person who is entering into healthcare, it basically for the non-technical, non-clinical person, it is thankless job. Okay. You have to be always active. You cannot say I have done for so many years something, so just get rid of that. It cannot happen in that way. You have to be active continuously, and you have to active with the technology which is going to come, and we have to also make sure that so whatever we have to implement for that, three things we need to always understand: positive mind, then always your meticulous planning of everything and execution. If we do it properly and if you are grounded, I am sure with AI coming up, there are a lot of chances that biomedical field will have a very good chance because totally depend on technology. Now to technology to certify before doing any surgery or operation also, they will require qualified engineers. So I believe that with AI coming up, biomedical engineers are also having very good opportunity to make their career into this field, but it cannot happen like share market, like one day you will get something a bonus. It will not happen. You have to spend time, either the way I said, once you enter into that field, you have to make sure that it is like sustainable, like mutual fund, go on and go on, then you will get a result.
Absolutely. I mean, reskilling and upskilling in terms of artificial intelligence is very, very important for the young leaders today. And thank you so much for that advice. I'm very sure this conversation will, be looked at from a different perspective for all those people, because we generally talk to chief information officers. This is the first time that we are talking to a different side of hospital operations, and fantastic insights that you have provided us today. And it will also help others in the CXO community to understand this part of the job and how it is done, and why it is important for their roles as well. So thank you so much for this fantastic insight and fantastic conversation, sir. Have a good day.